Yes, today I'm going to talk about my graduation project, which is a study of factors which impact ICD-10 AM morbidity coding quality. This project is supervised by Ms. Heather Green. This is a picture shows morbidity data which is collected by Australian Institute of Health and Welfare. The format of this data follows the International Classification of Diseases version 10, and the institute report the data to government and community. This data is very important for the purpose of epidemiological studies, clinical funding, and clinical management purposes. However, how much confidence do we have in using this data to support its purposes? Is the data quality for this data collection capable in supporting its usages? This research I'm going to talk about today. different stakeholders have different interests on a wide range areas of data quality of ICD-10 data as listed in the table. Traditionally, data quality issues were detected through audit processes and were seldomly published, which leads to two questions about this issue, namely, what are the general coding patterns? What leads to the discrepancies of senior coders who define correct coding? To fully research this problem, one needs to look at issues associated with data we collected. These issues include data standards, data modeling, and data quality, as well as issues associated with clinical management, such as epidemiological study funding and clinical coders education tips, making this research a health informatics project. Today, I'm going to talk about the design of this research, findings of the research, and my discussions and thoughts based on the findings. I'll start by research design, which is divided into literature review processes and data analysis processes. As for the literature review processes, I conducted a blurred search by combining these keywords, searching literatures from these database engines, and I also searched government reports of different regions. The results were then sorted by relevance, and if less than 1,000 entries were returned, first, the 100 results were manually assessed for relevance, while if more than 1,000 entries were returned, then first 200 results were assessed. During this manual filtering, whether the paper is relevant to this research is determined by the research objective of the paper, which is whether it is talking about ICD-10 data quality and data collection issues or not. As for the data analysis processes, ethics approval was obtained for use of existing data from Arrow. Data is collected from all hospitals across Australia and viewed by Australian universities teaching clinical coding. These data did not include any details of patients or users of the system. Their data model was built for later querying for the statistics. Data from Arrow for all episodes coded since January 1st this year until March the 31st this year. Statistical query algorithms to identify inconsistencies in the coding attempts were designed. This is a figure showing the data collection processes conducted by Arrow. The left side is the doctor's notes, while the right side is the collected coded data for this episode. The focus of this research is to investigate the data quality of the right side coded episode. Following those designs, the first finding identified from literature review is that data quality is an issue for coded ICD-10 episodes. This is an issue that appears around the world in different regions and are likely significantly affecting data quality of collected episodes for different studies as listed. The actual list of facts in my report is far longer than this. Here is the figure that suggests how frequent ICD-10 has been studied and how little the ICD-10 data quality issue has been studied. For each subject domain, the statistics about medical databases reviewed, health informatics database reviewed, and the engineering science database reviewed all support the statement that ICD-10 data has been widely used but less investigated of its quality. Here's some basic statistics obtained by querying the Arrow database. Those episodes were coded by 66 coders, and 21 among them were senior coders, while others were student coders. Among the 6,022 attempts they've made, nearly 31% are having discrepancies. For senior coders, the rate of making an attempt with discrepancies is more than 1/3. Here is another piece of statistics. It shows that in general, coding error rates tend to increase as complexity level of episodes increase. This research also associates each coding standard with the number of attempts that are having discrepancies, and those standards are ranked according to this number. I found that the numbers here are long-tail distributed. Other dimensions, such as number of codes incorrectly entered, have also been measured, and this distribution does not change as the change of measuring methods. Further investigation suggests that errors caused by different standards in different complexity levels tend to be highly related, which means this distribution does not change even as the complexity level of episodes change. Therefore, key focuses should pay to those standards ranking at the top. They are leading to high errors as the third major finding of this research. To be more specific, I mean we should especially pay more attention to those standards. Based on these findings, my first point to discuss is that researchers need to study more into data quality issues before they use episode data they think that is qualified and directly use that into their research. An important message is that do not take the data quality of ICD-10 coded episodes for granted. Although this is the first initial research in Australia that particularly quantifies the errors and looks into actual error patterns of those errors, future research are still highly required. So, what can we do to those errors? As my second discussion point, I strongly advocate that people research on episodes of ICD-10-AM to investigate improvements to ICD-10-AM standards associated with common errors. Since these errors tend to concentrate on particular standards that introduce them, although they appear as choosing a wrong code value in the episodes, the code value is not the key concern. Rather, the standards lead to this wrong choice of code value matters. Since this is the initial research that looks into ICD-10-AM data error patterns and inconsistencies by quantifying the errors and trying to discuss the patterns, limitations unavoidably exist. First of all, the literature review might exclude some ICD-10 data quality problems. Secondly, what happens in those standards that let errors concentrate and why they lead to higher errors remains to be further researched. Thirdly, as a byproduct, this research already discovered that error patterns differ from senior coders to student coders, but the reason was not confirmed. Finally, there exists a potential to improve accuracies by auto-coding after understanding more about coding errors and inconsistencies, but this remains a future research. Here are my selected references, and thanks for listening. Now I am willing to take questions, and I sincerely welcome suggestions to my graduation project.